There are actually 3 types of calcification that you can get in your Achilles tendon, and each of them are made up of slightly different stuff. And the reason this matters is because each type requires a slightly different treatment. So in this video, I'm going to help you understand what treatment works best depending on the type you have. Your doctor will be able to tell what type of calcification you have by looking at your scans, and we'll talk about the scans in a minute. But it's worth noting that I'm going to present this video as if each type fits into a nice, neat box. But in reality, they can overlap. You can have 2 of these types or more together. For those of you who don't know me, my name is Maryke. I'm one of the physiotherapists from treatmyachilles.com, where you get online physiotherapy assessment as well as treatment for any type of Achilles injury, all done via video call. If you want to know more about our online service, have a look at the description of this video. I'll put a link to the website there. The first type of calcification we're going to discuss are hard calcifications that's associated with chronic or ongoing Achilles tendinopathy or tendonitis. The calcifications themselves are formed by calcium phosphate salts that accumulate in the tissue and then form these little hard lumps throughout the tendon. Now, these little hard lumps can't be absorbed by your body, and it is thought that the salts leak out of the injured tendon tissue. So what you'll typically see on a scan is that you have the injured tendon that shows signs of tendinopathy. So you see disorganized collagen fibers and damaged cells, and then you have these little hard specks throughout the tendon tissue. It's very common in insertional Achilles tendinopathy, but it is possible to also get it in your mid-portion if you have mid-portion Achilles tendinopathy. However, not everybody with Achilles tendinopathy develop these types of calcifications. So it can't be as simple as injured tissue causes calcifications. It's likely that something else in the body needs to happen to actually trigger this process. And there is some evidence that elements of your general health that can affect tendon health can actually influence this. So people with diabetes or hypothyroidism, for instance, are more prone to getting these types of calcifications. As strange as it may sound, the research is showing that these calcifications may not actually be contributing that much to your Achilles pain. Many people without any Achilles pain also have these calcifications. And in our experience, people can fully recover from their Achilles tendonitis while still having the calcifications. Because remember, this type can't be absorbed by the body. What treatment works best? In the vast majority of cases, people can recover fully from their Achilles pain, get back to full function and not have problems if they just follow the same types of treatment you would apply to regular Achilles tendonitis. So we're talking about removing the strain from the Achilles tendon and slowly building the strength and reintroducing activities as the tendon recovers. We have got lots of videos and content about what the best type of rehab and treatment plans are and how you progress them for different types of Achilles tendonitis. So have a look at the description of this video if you want to know more about that. What we find the main difference is with treating people with calcifications in their tendons is that they can have a lot more pain, especially during the early days, than people who don't. And the tendons tend to want to flare up very quickly by doing very little. So the plans have to start very, very gently and then gradually increase, and the increase in load and building strength usually has to take a little bit longer than other people's because you can't make too big changes week on week. Other treatments that's often talked about in relation to calcifications are shockwave. Now, with this type of calcification, because it's a hard calcification, shockwave won't help break up that calcification. It can help with the Achilles pain from the tendonitis because there's some evidence that it might help some cases, but it's not actually going to get that calcification to be absorbed. Another one that people sometimes use are corticosteroid injections. In this case, it's best not to use it because corticosteroids are very good at dulling pain, but the problem is they can also inhibit your collagen production, so your healing slows a little bit, and there's some evidence that it isn't that great for tendon health. So because in this case you already have a tendon that's not in a very good state, it's likely best not to add that. I will say that in some cases it is an option because nothing else works for the pain. So it's not a definite no, but it's a very last resort. And then, of course, despite following all the treatment advice perfectly, some people's pain just does not want to react and calm down. And then surgery is an option. At the moment, it's advised that you have to try a really gradual loading program and all the things we've just spoken about before you head for surgery. But if you need it, then surgery can provide really effective pain relief. And the surgeon, in addition to removing the little calcifications, will also remove the injured part of the tendon. Now, the interesting bit is that the research into surgery is showing that often, despite the patient's pain being much better, the calcifications will return after they've had surgery after a long period of time, without actually providing them any more pain. So this kind of supports the evidence or the argument that the calcifications themselves are likely not causing the pain, but it's more the tendinopathy or the tissue injury in the tendon that's causing the trouble. Next up, we've got soft calcium deposits. And in this case, the calcium deposit itself may actually be the cause of your pain. This forms when some of the cells in your tendon, not all of them, just a few, changes from tendon cells to cartilage-type cells and starts producing high volumes of the substance. And the calcium deposit in this case is made up of carbonated hydroxyapatite, which I have no idea if I'm saying correctly. But researchers describe it as having the consistency of toothpaste. This is usually the type of calcification that you have if you've been diagnosed with calcific tendonitis. Now, unfortunately, people often don't realize that there's different types of calcification, and they use that term for other types as well. So if you're watching videos on YouTube and somebody's talking about calcific tendonitis and their advice is different from mine, it might be that they actually got the terms confused. Because even in the research, I found people not sticking to the definition of the diagnosis and applying it or talking about calcific tendonitis when it's clearly the other types that were included in the study. This type of calcification process can be divided roughly into 4 or 5 different stages, depending on what research study you read. It doesn't matter what you call them, but the 5 steps it often goes through is that you get the first stage where the tendon cells changes to cartilage-type cells. Stage 2 is where it then starts producing lots of this soft calcium-type substance. And during this stage, you may not even know that you have a calcification there. It is only if it becomes really large or in an area that it really triggers the tendon that you may start noticing a dull ache. And then it goes into a stage where it just stabilizes. It doesn't form more calcification, but it just sits there. And like I said, you may not even know you have it, but sometimes it can cause this kind of constant dull ache in that area. Then we enter the resorption phase, where the body actually realizes, we've got calcifications there, we need to get rid of it. And it sends lots of cells to try and absorb it. Usually there's quite an inflammatory reaction. That's why, depending on how deep the tendon is in the body that's affected, you may, for the Achilles definitely, you can see some redness, often swelling in that area. And it also sends and creates new little blood vessels into that area to help with the resorption. And this is the stage where it can be extremely painful. So during the previous stage, it's just this constant dull ache that drives you nuts. But in the resorption stage, where it's actually getting rid of it, it can be acutely painful. And then finally, after everything's been absorbed, the tendon often just repairs itself and it goes back to normal tendon cells and doesn't cause you more trouble. Researchers don't really know at this point why this process happens. One theory is that there might be a small injury that triggers it, but when you look at the scans of these people, often there's nothing wrong with the tendon other than having this large calcification. They have managed to identify several risk factors, and all of these risk factors has to do with conditions that can influence the general health of your tendons. So the first is as you get older, so people over the age of 40 are more likely to get this type of calcification, and the older you get, the more common it becomes. But it may also be because older people tend to have more other things that contribute to it, like for instance, type 2 diabetes. Diabetes has been shown to increase your risk, very high levels of cholesterol, as well as hypothyroidism. Then if you have a BMI higher than 30, so quite overweight, that can increase your chances. And if you have 2 or more of these factors together, it gives you a 10 times higher chance of getting this type of calcification. So there is quite strong evidence that likely it's the general health in your system that contributes to this process. But also, inflammatory arthritis can cause this type of calcification actually in lots of different areas of your body. So we're talking about psoriasis or rheumatoid arthritis, any of those inflammatory conditions. There is still a debate among researchers about whether statins can actually contribute to this process. Statins is a medication that's commonly prescribed for people with really high cholesterol. Now, you've noticed that very high cholesterol can also cause this problem. And the problem is that at the moment, some of the research studies are showing that statins may not be great for tendon health, and others are showing that actually it helps, while others are showing that it has no effect. So at this point, I would say really discuss it with your doctor. If you could see a clear line between symptoms in your musculoskeletal system starting when you got onto the statins, they may be contributing to some of those symptoms. And there's also a suggestion that some of the statins can influence you more than others. So they may be able to try something else and see if that works better. But at this point, it may not be the statins that's causing it. It might be the statins. We're not sure. But very high levels of cholesterol is not good for your general health. So it's very important to not just stop those medications without actually having a thorough discussion with your doctor. This type of calcification shows up differently on scans depending on what stage the calcification is in. But interestingly, they don't actually show up that well on MRI scans. You can often miss it on an MRI scan or interpret it as a different type of injury because it mimics the signals of tendon tears quite often as well. The best type of scan seems to be an ultrasound scan, or they can also show up on x-rays. And it usually shows up as quite a large lump in the tendon itself. And I couldn't find a picture of the Achilles tendon with a nice big calcification. So I've included the shoulder here because the most of the research is actually done in the shoulder. Now, in the vast majority of cases, researchers describe this type of calcification as being present in a tendon that looks otherwise healthy. You may see some blood vessels growing into the area if it's in the resorption stage, but you usually don't see signs of chronic tendinopathy or ongoing tendon injury. However, there has been some case reports of doctors going in to fix hamstring tendon tears and then finding large volumes of this type of calcification in there that they then also clean out. So it is possible to be there when you have a tendon injury itself, but quite often the calcification on its own is the problem and the tendon itself is quite pristine. What's reassuring about this type of calcification is that the research is showing that in many cases, the process can resolve itself, that it moves through all the stages, getting rid of the calcifications without any major interventions. Now, before you ask me how long this takes, I don't know, and the researchers don't really specify that. And I think it is because people are so different. It is usually only when you enter the resorption stage that you develop that intense pain, and it is often accompanied with quite a lot of inflammation in the area, which is different from chronic Achilles tendinopathy where you don't get inflammation. Now, the good news is that if we look at the research on shoulders, the evidence suggests that this resorption stage can resolve itself within 2 to 3 weeks. There isn't any evidence for Achilles tendons, and I only saw this mentioned in a research study once. So I'm not sure how accurate the 2 to 3 weeks is for this. Now, the treatment, if you're in this really painful stage, are all things that can help that tendon calm down. Often people find that taking non-steroidal anti-inflammatory medication, so ibuprofen, naproxen, it just depends. Speak to your doctor about it because different types work better for different people. Anything that can help calm the inflammation or that excessive inflammation down a bit can help. Applying ice might even help. Simple things like wearing shoes where your heel is higher than the front of your foot could help reduce your pain because that reduces the stretch on the Achilles tendon and therefore it's not pulling as much on something that's already painful. Now, if it's really painful to wear a shoe because it's pressing directly on it, you can think of shoes like clogs, where the back of the shoe is open, but it has a nice high heel. That could work. We have got videos about best shoes for Achilles tendonitis that might be useful in this case. I'll link to them in the description below. You definitely also need to apply relative rest. So with that, it doesn't mean that you've got to rest completely and do nothing, but you have to try and bring your activity levels down to a level that doesn't dramatically increase your pain. But wearing the right shoes can already allow you often to do a lot more during the day. Again, we've got videos about all of that. And then finally, if you are in this really painful stage, doing strong Achilles exercises like stretches or calf raises with extra weight or on one leg is not what that tendon needs. If you're going to do anything, gentle movements can often help reduce the pain, but definitely not anything that's going to strongly stretch it or strongly load it. Of course, not everybody's tendon is nice enough to go through all of these stages as it's supposed to. Sometimes that calcification gets a bit stuck in a certain stage, and then there are other treatments that can help. The first is shockwave. And there is evidence in shoulders that shockwave can be very effective to help break up these soft calcifications. We have got a video about what type of shockwave works best. There isn't any evidence currently for Achilles tendons because the research has simply not been done on that yet. So even though we have to take the research of shoulders for this, it is something I would try for my Achilles tendon if I'm a bit stuck with this. Barbotage and lavage are two techniques that doctors often combine. And it involves taking an injection needle, sometimes two, and putting it into the soft calcification, puncturing it several times to get the calcification to release, and also injecting high volumes of just clear fluid, saline, into that area. And then they draw it out and get the calcification out. They often also put a little bit of anesthetic and corticosteroid in there to help calm that inflammatory process down. Now, the evidence in shoulders are showing that it can be a really useful technique. There's very little research on Achilles tendons itself, but there is one case report where it worked really well. It is currently advised to use this technique for people who seem to be stuck in a really painful resorption stage and who hasn't had any good results with following the conservative plan we've just spoken about, taking anti-inflammatory medication, offloading that tendon, and just applying gentle physio. It is not advised for anyone with calcifications that's smaller than 5 millimeters, so it's got to be a rather large calcification. In shoulders, they do often use corticosteroid injections, just the injection, not with the lavage technique included, to help calm that excessive inflammation and pain down. And it does seem to have good results. The problem is that the tendons there are very different in their job that they've got to do compared to the Achilles tendon. With the Achilles tendon, you put all your weight through that tendon. And because there is a small risk of rupturing your tendon if you have corticosteroid injections into the tendon, it might not be a great idea to try this as a first type of treatment in Achilles tendons. However, I have just mentioned that when they do the barbotage and lavage, they sometimes also put a little bit of corticosteroid into that area, and that seems to be okay. But again, we don't really have a lot of research on Achilles tendon, so a pure corticosteroid injection on its own is not something I would try as a first-line treatment for this. I would likely try the shockwave and the barbotage lavage technique first before I consider just a plain corticosteroid injection. In cases where pain persists for more than 6 months, despite doing all the treatments we've just spoken about, or the calcification is really large, surgery can be a really effective and good option for this. Once the pain starts to settle, it can be very useful to start doing some gentle strengthening exercises and follow a progressive plan where you restore your calf and Achilles tendon strength. Because this type of pain usually carries on for quite a few months and you tend to not do much activity during that time. So both the calf and the Achilles tendon tend to lose a bit of strength. And if you then go back to your activities too quickly, you can actually end up creating other types of tendon injuries. But just as with normal Achilles tendonitis rehab, it's really important that the exercises you start with has to match your Achilles tendon's current strength and current levels of sensitivity. If it's too intense, it's just going to make your pain worse. So it's not, oh, I've got to strengthen now, let's do some single leg calf raises. That will likely just cause a flare up. It's got to be very gentle exercises at the start and slowly build in intensity until it matches the level of activity you want to be doing. We have got lots of videos about rehab for Achilles tendonitis or tendinopathy, and specifically for insertional cases. So if you're interested in that, have a look at the description of this video. I'll put a link to that there. The third type of calcification we're going to discuss are bone spurs. And these are little bony points that develop where your Achilles tendon attaches into the heel bone. As the name suggests, they are made up of bone and they can even have marrow inside sometimes. The reason I'm including them here is that part of the initial process is that they start through calcifications that then turn into bone. Now, when you look at a scan, bone spurs are quite easy to see because they show up as little pointy bits at the insertion of the Achilles tendon. And as you can see in this picture, there are also little specks of calcification around the top end of that point. So they often do occur in addition to other types of calcification as well. That point where your Achilles tendon attaches into the heel bone, actually where any tendon attaches into a bone, you have some cartilage cells in that area, and their job is to maintain the bone in that area. Now, sometimes some of these cartilage cells start to produce more calcium and more bone in that area, and then this pointy bit forms. Now, bone spurs can develop without you ever having had any injury in your tendon or inflammation. And it seems to be linked to how much the Achilles tendon or excessive pulling of the Achilles tendon in that specific area that then stimulates the cartilage cells to produce more bone. Interestingly, despite bone spurs looking quite as if they should be really painful when you look at a scan, they often actually don't cause pain. And many people who have no pain in a heel will actually have a significant bone spur. In one study, they were scanning people's legs, left and right, who came in with complaints of Achilles tendonitis, and they only had pain and symptoms in one side. And they found that 55% of the people also had a bone spur in the unaffected side that had no Achilles tendonitis or pain, versus 65% who had it in the injured side. So it was nearly as common in the uninjured side as the injured side. However, there is also research that shows that bone spurs are more common in people who actually have Achilles tendonitis versus ones who don't. And this is not really surprising for me, because bone spurs, the theory of why they develop is that it's overuse, it's excessive pulling of the tendon in that area. And that's also one of the reasons why Achilles tendonitis happens, that it's overuse and excessive work of the tendon in that area where it attaches to the bone. So it may not be that the Achilles tendonitis is the cause of the bone spur. It's more likely that the overuse of the Achilles tendon is causing both the Achilles tendonitis as well as the bone spur to develop. So from the research, it looks like you only start getting pain in the heel when you also get a tendinopathy together with a bone spur. And in our experience, many people who has bone spurs can actually recover despite the fact that they still have the bone spur. If the bone spur is really large or it actually breaks or fractures, then it can be the main source of the pain. There's currently not really any consensus about what is seen as a very large bone spur that definitely needs surgery. In one research study where they looked at how effective surgery was and who needed it and who didn't, they reported that even people with relatively large ones, 11 millimeter tall and 6 millimeters wide, recovered fine by just following a conservative plan that was aimed at treating the tendinopathy. And only people who had larger ones than that required surgery and then also did well after surgery. I have actually kind of discussed the treatment already, but because the pain is thought to be coming more from the tendinopathy than the spur itself, the first line of treatment is to treat it exactly like you would treat a case of a very sensitive insertional Achilles tendinopathy. Now, we have got detailed videos about how you adapt a rehab plan for insertional Achilles tendinopathy versus mid-portion, because they're very different. But if I can highlight the main three differences here, one is that you want to remove the stretch of that tendon. So you want to limit how much dorsiflexion happens in your ankle when you walk. And some of the easiest ways you can do that is by wearing shoes where the heel is higher than the front of the foot, because that puts the Achilles in a less stretched position as you walk, and that can really reduce the strain and irritation. 2, you definitely want to avoid calf and Achilles stretches during that early part of your rehab plan, because the more you go into that stretch position, the more the tendon is wrapped tightly around the heel bone, which then increases the pressure in that area and can really irritate it further. And thirdly, whereas with your mid-portion tendinopathy, you often do the exercises over the side of a step, with insertional, you usually start just to floor level so that you avoid, again, going into that stretch position. Because often if you load it too much into the stretch position, that can really flare things up. But like I said, we have got detailed videos about that, so look at the description if you want to know more about that. And then finally, surgery can be effective for this as well, but it should not be a first-line treatment. You should try 6 to 12 months of proper rehab where you don't overload it. You make sure that you load it in the correct ways to see if you can get the symptoms to settle and build the strength. But if it doesn't work through that, then surgery has been shown to be effective as well. Brilliant. Hope you found that useful. Let me know in the comments if you've got any questions. And if you need more help with your Achilles injury, you're welcome to consult one of the team via video call. The link to the website is in the description of this video. Take care.